Introduction to dysphagia. Dysphagia is the medical term for difficulty in swallowing. It can include discomfort, pain, food or drinks getting stuck, coughing, choking, heartburn, or feeling like food wants to come back up or regurgitate. Dysphagia can be classified by where in the swallowing tract it occurs. Swallowing difficulties in the mouth and throat are called oropharyngeal dysphagia. Dysphagia coming from the esophagus is called esophageal dysphagia. Your esophagus is the tube-like structure that carries food and liquids to your stomach. It runs from the bottom of the throat to the top of the stomach. Swallowing lets you eat, drink, take medicine, and enjoy life. If swallowing is difficult, you may feel anxious, or as you will learn, develop health problems. Swallowing involves over 30 muscles and several nerves controlled by your brain. Food moves from your mouth where you chew, through your throat, where coordinated muscles push it through your esophagus, the passage which carries it to your stomach. This complex process requires precise timing by your brain, nerves, and muscles. Any disruption can cause swallowing problems. Dysphagia affects millions of adults worldwide. It's especially common in older people and those who have certain medical conditions or treatments. Dysphagia can also occur in children. Dysphagia can occur from stroke or brain injury, nervous system diseases, head and neck cancers, immune system conditions such as scleroderma and myasthenia gravis, and GERD or other problems of the esophagus. It can also be caused by medications causing dry mouth, as well as radiation therapy, which can impact muscle movement over time. If you often cough, choke, or feel food stuck in your throat, talk with your doctor. Other symptoms of dysphagia can include pain when swallowing, drooling, trouble when you start to swallow, and a wet or gurgling voice after eating or drinking. Untreated dysphagia can lead to serious problems. These include a lung infection from food or liquid getting into the lungs, malnutrition from not eating enough, dehydration from avoiding liquids, weight loss, and social isolation or depression from avoiding meals with others. Early treatment helps prevent these complications and helps you live as well as possible. Collaborative team care is key in the diagnosis and in the care of patients with dysphagia. Usually, an otolaryngologist, head and neck surgeon, or ENT specialist, a speech-language pathologist, or gastroenterologist are involved in your diagnosis and care. A swallowing X-ray called video fluoroscopy involves drinking liquid that shows up on video. A test called FEES, short for fiber optic endoscopic evaluation of swallowing, uses a small camera on a tube called an endoscope to watch the swallowing process. Another test, manometry, can help check muscle strength. None of these tests hurt, and your healthcare team will be able to explain what they learn about your dysphagia. Dysphagia can be managed and treated. Management strategies can modify swallowing to better direct food to the esophagus. These temporary strategies compensate for the swallowing problem. Common strategies include posture changes, such as a chin tuck or head rotation. Sitting up straight and taking small sips or bites can also help. Other strategies include thickening drinks to help keep them from going down the wrong way. Soft foods and purees are easy for most people to swallow. Diet changes may be temporary until you learn safer ways to swallow or the cause of dysphagia is treated. Treating the condition causing dysphagia with exercise can help. Unlike management strategies, exercise therapies aim to permanently improve the swallow movements. For example, exercise rehabilitation can help if a stroke or head and neck cancer is the cause of your dysphagia. If a physical blockage narrows your throat, preventing food from passing through, you might need surgery or another procedure. For example, if the blockage causing your dysphagia is a cancer, the cancer treatment would be directed by your cancer specialists. Changing medications or treating conditions, like acid reflux or GERD, can make swallowing safer and easier. A therapist, such as a speech-language pathologist with expertise in swallowing disorders, can teach you exercises called swallowing retraining therapy for the muscles, nerves, and other structures involved. Exercises might include chin stretches, tongue presses, or practicing swallowing in a certain way. Simple, well-targeted movements can lead to safer, more comfortable swallowing. For patients with head and neck cancer for whom surgery or radiation may cause swallowing problems, starting exercises before cancer treatment may help prevent problems or make them less severe. This is called prehabilitation treatment, or prehab. Dysphagia can happen at any age and for many reasons. Good collaborative care makes a great difference. It's important to remember that swallowing is complex and that any change in the structure of the mouth and throat or the muscles and nerves involved in swallowing can affect the entire process. Asking questions, making informed choices, and working closely with your provider team is the key to coping with swallowing problems and staying as healthy as possible.